Tennis elbow. That's in the elbow, obviously. Is it just in tennis players?
Absolutely not. In fact, usually it's not. It's probably a misnomer because most of the patients I see anyway, and I think most people, are patients who don't play tennis.
Yeah, my wife said she had carrying her chair out to the beach. Where is a tennis elbow located? Can it be in a couple of places?
Well, traditionally a true tennis elbow is always on the lateral side or outside of your elbow.
What is that? Is it a break in the bone, or what is a tennis elbow?
What it is actually an overuse injury to the muscles that begin on your elbow that go to extend or straighten your wrist, and it's caused by microscopic tearing in the muscle origin.
Wow, so it tears. So again, we elevate anti-inflammatories, ice, or do we have to do something?
That's always a good start. Sometimes, stretching is a very good exercise for that. Stretching it like this, kind of pulling the muscle against, the way it usually goes.
The problem is that when you're doing this, that it makes the tear right there.
Correct. So you can, with your elbow straight and bending your wrist down, often you can push up against a wall like that. That's a good stretch for it.
You see all these arm bands that people
Yes,
put.
sir.
Where would you put that, and what does it do?
What that is really a way of taking some stress out of that muscle. And it actually doesn't go on the sorest part where it is on your elbow, but just over the fattest part of your elbow down here where the muscle is. And what it does is just by placing some tension on that muscle, it basically takes some tension out of the muscle and it relieves pain that way. And it's a tennis elbow strap, we call that.
How long do you wait before you have to have surgery, or what do you do? Anti-inflammatories, physical therapy, rest, got to stop doing what was causing it?
Cortisone shot is something that we'll often do.
So cortisone shot will help that. Do you inject that right into the elbow area?
Pretty much, just near where the tendon inserts onto the bone.
And what does the cortisone do?
Again, that's a strong anti-inflammatory agent.
About the strongest you can get.
Yeah, and it's a real strong dose to that area where we inject it. It's not a huge dose to your body. Your body makes cortisone, as you know, but it's a pretty strong dose to that area, and it will often decrease the inflammation pretty dramatically and can really alleviate a lot of the pain that comes with it.
Do you ever have to do surgery for a tennis elbow?
Sometimes, but it's pretty much a last resort on tennis elbow surgery, on tennis elbow problems. But we do once in a while.
If you got tears in the tendon, what do you have to do? Make it more complete and sew it back up, or what?
Well, there's different ways of doing it, but the way I do it, and most commonly is done, I believe, is to remove the torn or damaged tissue so that kind of healthy tissue can, fill in and repair that tendon, basically. A complete recovery.
Your advice as an orthopedic surgeon to the weekend warrior:
stretch.
Stretch before you do it.
Yeah.
Stretch all your muscles. That means upper extremity, lower extremity, shoulders,
Absolutely.
hips, and
Absolutely.
that will help keep you from getting an injury.
It's probably the best thing you can do.
Jay Reynolds, I want to thank you for taking your time to come to the Dr. Bob Show. You've been a great teacher, and I feel like now that I either need to warm up and stretch a little bit more slowly or exercise every day like we want you to do on the Dr. Bob Show.
Thank you, Bob.
Thank you for coming.